I had 3 goals coming to this country. I am a single mother, so I had left my son with my mother in Jamaica. So my intentions were to educate myself so that I could have a good living, to buy a house, and possibly get a husband to help me raise my son. And I think it was that endeavor. We're negotiating condom use was not even a part of my thinking. In 1994, while I was working and going to Rutgers University, I became ill and I was diagnosed with HIV. That was the most devastating thing that ever happened to me. It was the hardest period of my life. I was in my 30s and I still hadn't brought up my son yet. It had taken me 6 years to secure a change in my immigration status, and luckily that happened before my diagnosis. I remember in 1994, I didn't have health insurance, and I was at Rutgers, and I was diagnosed there in the clinic, and the doctor said, well, we can't manage the disease. So I went to the local clinic in Newark, and I was so overwhelmed. I was always full-bodied, so looking at other people who were there, I just didn't feel that I looked like them and this was a place for me, but I had to stay there. I didn't have any choices. I remember refusing to take medication. I just said I will come every 3 months. My focus was to get a job that had insurance. And so in 1995, I was able to get a job that had insurance. And I went to a private doctor, and that doctor by 1996 says you have to do something. And so in 1996 I went on protease inhibitor. So I went on meds, and through the grace of antiretroviral therapy, it has sustained me for the last 23 years, and for that I am grateful. I knew that to survive, I had to see the doctor regularly, and I had to take my medication. But I didn't want to be a part of support groups. I didn't want to be involved in that way. I just felt like I just need to raise my son. I just need to work. I just need to earn money. And I just need to survive. And so for all women, whether you're immigrant or not, there are different priorities in your life. And oftentimes your health is not the number one priority. Often it is, how do I put food on the table? How do I take care of my children? I remember very clearly, I was working at a home care agency, and I had started on antiretroviral therapy, and they were making me sick, and I kept coming in late. My supervisor, I remember, she pulled me up to ask me what was going on and was almost very punitive, and I felt in that moment there was just an anger that rose in my chest. And this was the first time that I was telling somebody outside of my immediate circle that I was HIV positive. So I decided then that, I'm going to try and get a job inside of HIV arena. I got my first job as a health planner at the Newark EMA HIV Health Service Planning Council. And it was in the arena, and I felt that if I was working for HIV, then this was a safe space for me, and I could be who I was, and I could talk about HIV. I became their representative to the Care Coalition in DC, and started to really understand legislation, Ryan White legislation, and become really very active. And that led to different opportunities. I was well-spoken. I was willing to talk about HIV. And in the core of my heart, I felt the need to represent myself and to represent other women and people living with HIV. I've been at HYACINTH for the last 11 years. HYACINTH is the first and largest AIDS service organization in New Jersey. It's been around for more than 30 years. It started at the start of the epidemic in 1985. Our mission is threefold. We serve to reduce the spread of HIV by providing prevention intervention services, to help people live with HIV by providing support services, and being a part of the public debate around HIV. We are clear and we understand that access to healthcare, access to medication, access to services is a lot dependent on policies that are made at the national level. So I was raised in the church and have always gone. And, when HIV became my reality, I went to the church for support. It didn't mean that I was open about my HIV status, but I needed the spiritual support that church gave, and it was good for me because there were different people who emerged that supported me. In 2006, as a part of my job at HYACINTH, we began a program called One Conversation, and it was specifically targeting faith-based organizations, especially minority faith-based organizations. My job was to really reach out to faith-based organizations across the state, establish relationship with them, provide opportunity to educate not only pastors, but the congregation. And I did that for 6 years. And I went into many different denominations. I have experienced a lot of resistance. Ministers, on a whole, are compassionate, but they operate under ideologies that sometimes, a lot of times, really emphasize certain things versus other things, and create an environment often where people like myself don't feel safe. One of the things we need to do is to be more open about sexual health, the importance of sexual health. We're all sexual beings. Oftentimes, faith settings shy away from having that discussion about sexual health. And because they do it, because it is a part of the culture, people are secretive about what they are doing. So people are having unprotected sex, not using condom, not accessing condom. I must say, over the last 6 years that I worked on that program, I have seen some changes. One of the things ministers said to me is, we don't know how to begin the conversation, or we don't know how to have the conversation. So what we did was to develop a manual for churches who wanted to start ministries. And one of the things we said, it's not just HIV. The structural issues that impact HIV impact all other diseases, right? You can talk about diabetes and high blood pressure and talk about STDs and then talk about HIV. Faith-based setting and faith-based organization have a role to play, a very powerful role. And in the life of women, when you go into most faith setting, it's filled with women. So they can be an example. They can create environments where testing become normalized, where condoms are used. We support abstinence, but the reality is we're all adults, right? And we're going to make choices. So let's know what our options are. Faith-based setting is a great environment where people can look at their spiritual life, look at the core of who they are. Why not also look at the physical?